Hey, everybody.
Hey, Jerry. Good morning, Arvind.
Good morning. So good to see you.
Hello, Fred.
Oh, I see.
Hello.
Rana. I see Matt.
Jerry.
There's Horst, there's Jerry,
Matt's joining us from Berlin. Yeah.
there's Emily.
It's like a family reunion.
I'm Gary Gunderson, and TC and I are here in Winston-Salem. And we love this background. TC's sister painted this, and it is the spirit of many faiths and picture of God as a bright sun coming up. So we love this background. I want to honor the sacredness of this amazing collective coming together for personal and for collective reasons to be who we're trying to become. Individually, we might take something from this Zoom and we may have something we want to say, but there is an us. There is a unity. There is a form of life that is emerging from this intersection, this confluence of the tribe of positive deviance and the tribe of leading cause of life. And those of us, who may have other tribal names, who are drawn to this because we want to be part of something. And we want that something to be alive, and we want it to move. The thing that is alive is deviant in the most positive way. And it is alive. We could use the language and the leading cause of life to describe the emerging form that is us. In this moment, in the different communities, you look around this screen and realize we live in so many different places. And in this moment, every one of our neighborhoods is living in the deep, scary shadow of COVID, still in the deep, dark shadow of 8 minutes and 46 seconds of George Floyd and the other names who now have become common in all of us. And we're only halfway through 2020. We haven't gotten to the hurricane or the election yet. This humble Zoom is part of the becoming, individually and collectively, the people that I would say God wants us to be. So with that, I'm going to hand it over to Arvind, who's not wearing the cool hat that he was last time, but it's still pretty handsome.
He's got background figures there.
There we go.
Yeah.
Some of you know I had a correspondence relationship with Mother Teresa for a very long time. So this story especially speaks to me, and hopefully will speak to Gary, what you've said and what will follow. So this photojournalist had a 15-minute slot, a precious 15-minute slot with Mother Teresa, and was just about to interview Mother Teresa in the open courtyard of the Missionaries of Charity in Calcutta when a car screeched to a halt. And it was a convertible in Calcutta, a big Chevrolet with an open top, and a couple jumped out. Lo and behold, Mother Teresa is there at the entrance. They ask Mother Teresa if they could have a picture with her. And, Mother, in her gracious, smiling way, yes, of course. And so they hand the photojournalist their camera. And, of course, the camera is in good hands. And, she takes a picture or two and hands the camera back. And they say, oh, no, we'd like a few more shots. And so, she takes a few more shots. And then they say, oh, Mother, could you just move a little? And, could we be on either side of you? And Mother, of course, smiles and obliges, and the photojournalist is about to again hand the camera back, and they say, oh, we definitely want a shot, by this beautiful sign which says Nirmal Hirday, which basically means a compassionate heart. So you have a sense of where this is going. 15 precious minutes and being eaten away by a couple who clearly were on a mission. So a few minutes, 7 or 8, have ticked by, and while she's clicking the pictures, you can imagine what's happening inside. seething is the word that she used to describe this, clenching her teeth and her fists and, really wanting to choke them for this absurdity. They finally depart, and now only a few minutes are left, and Mother Teresa is her usual self. She's calm, she's smiling, and the photojournalist says, "How could you entertain?" And she couldn't even complete her sentence. And she said, Mother put her hand on my shoulder and she said, "My child, you have to remember that in this world of ours, there are different kinds of poverty. There is material poverty, but my child, my whole work is about, in some ways, addressing the poverty of the heart, the poverty of the spirit." And I have sort of reflected on this story a great deal, not so much for what Mother said, but I think what Mother Teresa is telling me, at least, is that while there are different kinds of poverty, there are also different kinds of abundance. While there are different kinds of disparity, there are also different kinds of equity. And while it's a long way from Mother Teresa's Calcutta to Hollywood, we all need allies. But I'm inspired by the story of how jazz icon Ella Fitzgerald, who was not being booked by these clubs in Hollywood until Marilyn Monroe, a very dear friend, said to these nightclub owners that she would sit in the front row every time they allowed Ella Fitzgerald to perform. So I guess there are different kinds of fragmentation and there are different kinds of connection. And there's so many beautiful stories of Mae West telling her producers at Paramount that, "No, I'm not starring in this film unless Duke Ellington and his orchestra are with me on stage." So the different kinds of poverty, and there are different kinds of abundance, and there are different kinds of disparity, and there are different kinds of equity, and there are different kinds of fragmentation and different kinds of connection.
It's hard to follow the great storytellers in our group, but I am delighted to be with you all today. Greetings. I know some of you it's evening, morning, some may be the middle of the night. I'm really delighted today, though, to introduce a dear colleague and an LCLI fellow, Sunny Anand. We decided to focus on Sunny's work in Memphis around decreasing disparity because of what Gary mentioned, what's going on in the world right now, the Black Lives Matter movement. It's long overdue. It's something that I hope and I pray will really result in long-lasting substantial change. But the violence against all sorts of folks, back and forth, verbal and otherwise, the political rhetoric and divisive tweets that are coming out of certain places, unfortunately, it's wearing on all of us. It's stressful. And I think it's also particularly poignant in terms of our brothers and sisters of color being hit so much harder by COVID than some of us in terms of both suffering and illness and mortality. To me, it really does speak to all the leading causes of life, but particularly it gives us hope. It's agency for something that can be done pretty quickly. Most of us that work in the medical or the healthcare field know that it usually takes what they say to get from bench to bedside. It usually takes sometimes upwards to 16 years to actually be tested, vetted, proven, and then move into clinical practice as a standard. Dr. Sunny Anand is a physician, is a professor of pediatrics, anesthesiology, perioperative, and pain medicine at Stanford School of Medicine, University of Oxford, and was a Rhodes Scholar there doing his doctoral work, and then completed the advanced medical studies in the United States at Harvard Medical School, Boston Children's, and Mass General. But most important about Sunny is that he's a man of great faith and compassion. My favorite story about Sunny was when he was at Methodist in Memphis. The folks that he worked with in the ICU, the staff, the colleagues, the parents, the children, the kids that he worked with, and the babies, they had a nickname for him that I think sums it up. Because of his compassion and gentleness and kindness, they called him Dr. Love. So without further ado, we will turn things over to Dr. Sunny Love Anand. So Sunny, welcome. Thanks for being with us.
Thank you, TC. This is really the most loving introduction I've ever had.
I doubt that. Yeah.
Can't say much after that. This is something that we do in the pediatric ICU. We look at our observed mortality rates. And then based on the severity of illness, we have really good algorithms where we can say, what is the expected mortality rate going to be? And so when I reached Le Bonheur Children's, I did this analysis. This is what every chief of critical care or PICU medical director does within the first 2 weeks of getting there. And I saw that our observed to expected mortality ratio was 1.89, which was totally unacceptable. The best PICU in the country at that time had an observed to expected mortality ratio of 0.55. So, there were 45% less children dying than were expected to die in that ICU. But in our ICU, it was completely the opposite. There's 89% more children dying than were expected. And so what are the underlying causes? Now, I hate to say this, but this is sort of traditional epidemiology. What are the underlying causes of death? And so what turned out was that our ICU in Memphis had a very high mortality rate amongst children from Hispanic families, Hispanic and Latina families. And that was quite surprising. It was, in fact, 3 times higher than either African-American children, which is the majority of our population, because 68% of the Shelby County area is African-American, or the Caucasian, or the other, ethnic racial groups. So this was very, very, this was really shocking and totally unacceptable. So we discussed these results in the, various ethics committees. TC and Gary helped bring this to the system, the healthcare system that we were part of in their bioethics forum. We talked to the senior leadership council at the hospital. We had a quality council in which the CEO was the chair. Talked to the entire physician staff, residents, fellows, nurses, respiratory therapists, whoever was willing to listen to the story. And we said, we've got to fix this. We need to launch some things really urgently. So within 6 weeks of getting these results, we had put in motion what was to be the very first multi-level healthcare delivery intervention at that time. Up until then, there were about 150 papers showing disparities in healthcare and outcomes, but there was nothing showing other than some policy initiatives that were being considered at the state and federal level. There was really there's nothing that empowered people locally to, find local solutions. And that's what we needed to do. We could not wait for the federal government. So that's how this whole story started. Our first sort of stop, this was in December 2009, was to educate all the healthcare professionals about culturally competent care, about what are the values, what are the practices in Hispanic Latina families. It took some education. We connected with local leaders and community reps, in various parts of the city. But what also became clear to me was that we need to have more bilingual staff, because there are nuances. There are things that get lost in translation. There are facial expressions, non-verbal communication that is misinterpreted. A simple sign like this can mean, wait a minute, or can mean, an abusive thing in different parts of the world. What happened was our CEO was Mary Armour. She was a former nurse, and so she empowered her chief nursing officer and our PICU nurse manager, and we got, about 7 or 8 bilingual nurses, so that there was 1 or 2 at every shift. We also, because I was chief of critical care, recruited faculty, recruited fellows. We had multiple residents who came by saying they're willing to help. We then made a proposal, and it was finally funded, for having 24-hour interpreter services available in the emergency department and the pediatric ICU. Up until there, interpreters were only available from 8 to 5. So all of this happened in November and December 2009. The next thing, starting the following year, 2010, we translated all the consent forms, all educational materials, pamphlets, websites. The website was a much delayed thing. It was later in 2010. But we also, I also realized when I did an analysis as to when these deaths are occurring and who's the attending on service at that time, there was a pattern that emerged. I made a proposal in our group and said, whenever we're having end-of-life discussions, we need to have a palliative care consult and a palliative care person in the room with an interpreter, just so that we have one other sort of set of eyes and ears, participating in the empowerment of life, in the connection that we're trying to establish with these families. Children who were arriving with critical illness to the emergency room were had a higher acuity, were more critically ill than was. So it was obviously a question of healthcare access. So we went to the mayor's community council and made outreach efforts. I personally went to 4 Latina churches and talked to the pastors and people over there. And we got help from the city government and the local health department. The Tennessee Shelby County Health Department made available mobile vans, made available immunization services, all those kinds of things. And if I may share my screen, we saw a drop in the mortality rates for Hispanic children within 1 year. By the end of 2010, we had already made a difference. By 2011, there were no statistically significant differences. The results were obvious because we were looking at mortality rates every 3 months to see if this intervention was becoming effective or not. From a 3-fold higher mortality, we were like 1.3 or something like that, not statistically different. And in 2012, there was really no difference. In fact, this graph was tweeted a few thousand times by various people in the pediatric community. And it really showed that local efforts, local champions can alter the health equity environment in their areas.
That's amazing, Sonny. And having been a little bit on the cusp of that work, the rapidity with which those changes were made and the lives that were saved was just amazing. And how you engage stakeholders across so many different areas and sectors. But I'm going to move now to my brother, Kevin Barnett, who is based in Oakland, California, and works for Public Health Institute. And it's got that great Canyon background. What resounds with you with what you've heard from Sonny?
We have immense challenges before us. And I think what Sonny has shared shows what is possible with focused effort with a specific population cohort. But of course, what we are up against and what healthcare in general is up against is that the structural obstacles and insults that so many of our populations are faced with are far beyond what we can do in the healthcare arena. And I think we grapple with how to become more engaged and how to really lift up the voices of healthcare with others in a way that actually makes a difference at the level of our communities and our society. With that is what the horrific events of recent weeks, which are a reflection of horrific events that have occurred throughout our history, have galvanized us in a way that, at least in my lifetime, I've not seen, and galvanized us across race, ethnicity, and social class. And while I am an aging cynic, I am optimistic that we are in a position to move things in a way that we haven't before. I was asked to give a 15-minute presentation to thousands of members of our health system. I'm a board member for the Trinity Health System. A 15-minute talk on the history of racism in our country. And asked to do that, I immediately reflected on the blog sent out by my brother Gary a few weeks ago that was entitled Shh, and spoke to me as a white male that maybe the good thing for me to do is to sit and listen and take things in for a while. And I in fact have done that, and at the same time, there are a number of other members of our board who are people of color and who, while I have deep empathy and appreciation, and being a student of social justice and civil rights issues, a deep understanding of what their experiences are, but I could never walk in their shoes. And in that, I feel a deep responsibility, in fact, to not always have them be in a position to speak on their behalf, to address, to name, and to identify very definitive ways that we can be anti-racists. I'll just give a final point. While the term that we use so often in healthcare is disparities, I have a problem with that term, in part because it suggests that these differences are, for all intents and purposes, accidental. And maybe even those involved are the cause themselves of their misfortune. It's important to me to stay with the term inequities because it reflects, particularly in our country, a very proactive and a definitive set of steps that we have taken at the government level, at the business level, and it has been profound and persistent throughout our history. It's clear to me what the work is that we have before us. And it's clear to me that our friends and colleagues, brothers and sisters in the healthcare arena can do more than simply provide better access to healthcare. They are among the most powerful, largest employers in most of our communities in this country. And we must speak together and engage and move this agenda together. So I appreciate deeply the leadership. It's reflected in what Sunny has shared.
I truly feel our work has just begun.
And I say, let's take the next step.
This is Steve Scoggin. I would love to hear your reflections on the sources of your optimism for this moment in time.
That would be a good Zoom, wouldn't it? Yeah.
This was what inspired me after finishing my training in Boston to go and live in the Mississippi Delta area for the majority of my career, 22 years. Simply trying to improve critical care in those parts of the country. We recently opened a completely free of cost clinic for women and children in Clarksdale, which is in Coahoma County, one of the poorest counties in Mississippi. I have applied for a Mississippi license, and my friends and I were volunteering there. That clinic has been going since January of this year. We hope to make a change.
Thank you for not abandoning the Mississippi Delta. We desperately need the work of others. And thank you, Kevin, for your comments. We're going to hear from Dr. Lucia Dura.
Thank you so much for inviting me to share, TC. On a personal level, hearing Sunny sort of reinvigorates my research in end-of-life conversations within the Latinx population. We've been doing a brief study here on the border about that from a communication perspective, a user experience perspective, and we used improv to get healthcare providers and kind of reenact the healthcare and the provider and patient conversation, and included families in there. And we learned that this is such a deeply personal thing. Having the end of life conversation is not just about receiving a set of guidelines and then following the guidelines, going through a checklist, but it touches on things about God, that only God knows when I'm gonna die. And I don't want to go down this conversation path, because what if I do die? What if I jinx myself? There's a lot of beliefs inherent in some of the health work we do. Hearing about Sunny's study just makes me want to pick that back up. I've been doing a lot of work in administration right now, so I put that to the side, but after this call, I will pick that thread back up. I'm also inspired to continue to have faith in the local. When I read through social media, it's hard not to get overwhelmed, and it's hard not to get triggered and feel pulled in many different directions and to forget what is going on here. Last night I was following a local thread advocating, for brown leaders, for brown people in our community. Our community is 80% Hispanic of Mexican descent. There are many leaders in the city who are not Hispanic. And so it's hard not to feel torn. But I think this idea of listening is important. I think I packed a lot into that. We could tease out quite a bit from just there, but that's what your presentation inspired in me, Sunny. So thank you for this opportunity.
Oh, thank you, Lucia, and congratulations on being a dean now. I think you weren't a dean when we last saw you, but don't leave the work. We need you. We need your spirit. Thank you for that. Sunny, do you want to comment quickly on what Lucia said?
Thank you, Lucia. We live in momentous times. We have this enormous opportunity. Within these few years, racism can be changed forever. Never before did we have the tools that we have now. The tools of communication, the tools of social media and instant individual input into mass communication. But it's important that the right messages are shared. These are very powerful tools, and it is you and I and all of us together, it will take to change this whole mindset. Gone are the days Jim Crow. Gone are the days of the civil rights movement. Gone are the days of Donald Trump. Who we are is the soul, the spirit of the American people. And that is undergoing a transformation, which is really exciting to watch.
Well said, Sunny.
You may have on your mind, what does this dialogue mean for me? And secondly, what's it mean for us? What have we experienced here? And what is next for you or for us? You can sort of go either way. hit return and you'll see the chat waterfall.
The rich waterfall.
Wow, 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 wow.
Nice.
Wow, 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 wow. Wow, 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 wow. Wow, 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 wow. Wow, 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 wow. I'm still missing the beer, but this is pretty good.
Next
Pretty
best
good.
thing.
Yeah. Wow, 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 wow.
Nice.
What a smart group. The next Zoom, we're going to interview Horst about what he has learned of his extraordinary experience in the role of race and in the public and finding life. Jim, do you have a last word?
I think what you just said is the last word, and I know that I was in a breakout room with Horst where that's exactly the question he faces as well. So I think that's a question that's worth leaving with all of us. There is no cheap grace here, if I may use a theological term.
Thank you, everybody. Thank you for joining us, giving the time. Sunny, that was extraordinary. Kevin, Lucia, Jim, Arvind, as always, thank you so much. What a treat.
Thank you, guys.
For pulling this together. Thank you.
Great day.
Have a good weekend.
Thank you.
Ciao.
Thanks.
Ciao, ciao. Chris gets the next work.
I hope Gary's got the right recording.
We'll see.
Sweet potato shoots. Bring your sweet potato shoots. Sweet potato shoots. Bring your sweet potato shoots. Sweet potato shoots. Bring your sweet potato